Why is it so hard to wake up in the morning? Well, after we wake up and our eyes are exposed to light, it takes a little while for our body clock to kind of kick in again to promote alertness. We often don't reach our first peak in alertness until about midday. And so from a body clock perspective, this can explain why it takes us a little while to feel good in the morning. How we feel upon awakening also depends upon what stage of sleep we've woken out of. And so if we've woken up out of a lighter stage of sleep, you're likely to feel a little better than if you were to wake up out of a deep stage of sleep. So by understanding the different stages of sleep and our body clock, this can help us to explain why it takes a little while to feel good in the morning. What happens if I just can't sleep? Well, if you have difficulty falling asleep, staying asleep, or waking too early, or perhaps you're not able to sleep at the times that you want to, this might be an indication that you're experiencing a sleep problem. Generally, to diagnose a sleep problem, the sleep problem needs to occur more days than not, and generally needs to have been around for at least 3 months. If you think you might be experiencing a sleep problem, I would recommend that you seek help from a health professional such as your general practitioner, who can make an onward referral to, say, a psychologist like me who has expertise in treating sleep problems. How do you treat sleep problems? As a psychologist, we have lots of tools that we can use to treat sleep problems. One way is by targeting behavior, so for example, changing what time you go to bed and what time you wake up, or perhaps how long you spend in bed to improve your sleep. And we also target people's cognitions, so ways that people think about their sleep as well. This type of treatment is known as cognitive behavioral therapy, and when applied to sleep problems, it's often referred to as cognitive behavioral therapy for insomnia. Cognitive behavioral therapy for insomnia is very effective, and many people may be unaware that it is in fact the first-line recommended treatment for sleep problems such as insomnia. Could you die as a result of a lack of sleep? I think it would be quite rare that somebody would pass away as a direct result of lack of sleep. However, if you don't sleep very well, this can obviously adversely impact both your mental and your physical health. And it might put you more at risk of experiencing accidents, for example. So it can have a very detrimental impact on your well-being. There is a very rare genetic condition though called fatal familial insomnia. And amongst other symptoms, this condition is associated with poor sleep. And indeed, the individual does eventually pass away as a result of having this condition. Can medicinal cannabis be prescribed for insomnia? Well, yes, it can. There is early evidence to suggest that it is effective for improving sleep problems such as insomnia. Do melatonin tablets work well? This is a tricky one to answer because there are lots of different types of melatonin. Melatonin that you might get from your pharmacy on the shelf, many of these homeopathic preparations actually contain very little to no melatonin and are not likely to be very effective for the treatment of sleep problems. There are other forms of melatonin, such as exogenous or compound melatonin, that can be very effective for treating particular types of sleep problems known as circadian rhythm sleep-wake disorders. This compound melatonin can be used to either move the body clock earlier or later, and in this regard it can be very effective for treating particular types of sleep problems.